This is Kenya News Update today. A country with some of the world's most valuable diamonds just declared a public health emergency. Patients went without medicine. A system built on billions in diamond revenue collapsed. But here's the twist. The diamonds didn't fail the people. The system failed the diamonds. Coming up, you'll discover how a nation's greatest wealth became its biggest weakness and the radical plan to rebuild from the ground up. Meet President Duma Gideon Boko of Botswana. He's not just a leader, he's a doctor facing a national crisis. Last year, shortages of basic medicine forced his hand. He declared a public health emergency. For a nation committed to free, universal health care, it was a moment of hard truth. Patients suffered, not because health workers failed them, but because the system did. And here's what nobody's talking about. This wasn't caused by poverty. Botswana is a stable, middle-income country. This was caused by a seismic shift in global health. As donor assistance dries up across Africa, governments are being exposed. And then something shocking happened. The very diamonds that built Botswana's health system also masked its fatal flaws. Problems were paid away rather than fixed. Drug prices were inflated many times over. Supply chains were inefficient. Public capacity was hollowed out through outsourcing. These failures accumulated for years. But when diamond revenues fell amid a market downturn, the fiscal shock made them impossible to ignore. The prescription from the outside world? Inject more private sector rigor. But here's the part that will blow your mind. President Boko says that's the wrong medicine. Greater reliance on private provision fragments care, raises costs, and diverts scarce health budgets into profit margins. When healthcare is outsourced, accountability becomes blurred. But when shortages hit, it is the government that people turn to. His message is clear: democratic responsibility cannot be subcontracted. So what's the plan? Botswana is fighting back with a radical public-first overhaul. They are bringing their largest private hospital into public ownership to relieve pressure. They are restructuring the national medicines procurement body, making it autonomous to cut bureaucratic delays. A National Health Intelligence Center will soon be operational, using real-time data to forecast medicine demand and prevent shortages. And once the health insurance bill passes Parliament, health funding will be ring-fenced. This ends their exposure to the wild swings of the global diamond market. Together, these reforms will determine whether a mother can find antibiotics for her child, or whether a patient needing dialysis must travel huge distances for care. But no country of 2.5 million people can fully shield itself from global shocks. The implications are massive for all of Africa. Some say this is a blueprint for resilience. Others say it's a desperate gamble with public money. The controversy is real. Can a system built on outsourcing be rebuilt with public capacity? And here's the unanswered question. If a diamond-rich nation can't make healthcare work, what hope is there for others? This is bigger than Botswana. It's a test for every nation relying on a single resource. The stakes are a mother getting medicine for her sick child. Do you think bringing private hospitals into public ownership is the right cure? Or is it a step backwards? Drop your take in the comments. Subscribe to Kenya News Update today for more breaking news on Africa's future.